This is a prime example of why it is so important for Black people in Canada to have a Black doctor, and B, the healthcare system to have race-based data. Take a look at this.
What if I told you that a Black woman was told she might have leukemia all because her normal test results did not match a white standard? Vanessa was a 21-year-old medical student when she started feeling off, so she got her blood tested. But days later, a doctor told her she had low white blood cell counts and might have cancer. Now, as you can imagine, she was terrified, but then she saw a different doctor, a Black doctor. He told her she was fine and that her numbers were normal for her. What she had wasn't cancer. It was something called benign ethnic neutropenia. Here's the problem. That name and the outdated standard behind it still label many Black patients as abnormal even when they're perfectly healthy. Doctors have been using white male reference ranges for decades, but nearly 67% of Black people carry a genetic variant called the Duffy null trait, and that naturally lowers white blood cell counts without increasing risk of infection. Because of this, Black patients are more likely to be told they're sick when they're not. Some go through unnecessary cancer workups, some miss out on surgery, some are even blocked from clinical trials or given lower doses of life-saving meds, all because of a test that was not built for them. And it's avoidable. A simple $30 blood test can check for the Duffy null variant, but most doctors never order it. It is time to stop pathologizing what's normal for us and start building a system where test results reflect who we really are, because equity isn't just a buzzword. It's a matter of diagnosis, it's a matter of treatment, and it's a matter of trust.
This is a very common thing that happens. A Black person goes in, says, I'm not feeling well, whatever the case is. You get your blood work done, and then they panic, and you get the call, and then you're told, oh, these labs are off, and it means this, it potentially means this, and it's always something grave. And do you know why that is? Because there is a lack of race-based data in Canada, in the Canadian healthcare system. All of these analyses are done off of a 30 to 40-year-old healthy white male. Now, there are a lot of Black organizations that are pushing for race-based data to happen here in Canada. So it's somewhat getting there, but it's still very fragmented. It's still very much based on the 30 to 40-year-old white male. So in this case, this Black woman had a low white blood cell count, and it's called neutropenia. And I know that because I have it. I have a low white blood cell count. And I remember, because every year I go for my annual physical and they draw blood and stuff. And I remember getting that call. I want to say it was around 2022, 2023. And I was told that, oh my gosh, your white blood cell count is very low. This is a problem. This means infection. This means, it can mean leukemia. It can mean this and that. And I was in a state of panic. And then they said to me, you have to follow a hematologist. So I went to a hematologist, and this hematologist drew a whole bunch of blood. And I had to follow this hematologist for 1 year solid. So every 3 months, I had to go get blood work done. And it was a battery of tests. I mean, they test everything: hepatitis A, B, C, D, E, F, G, leukemia, HIV. I mean, the list goes on, okay? And so for a year, I had to follow this hematologist. And then at the end, they found nothing. So then the doctor said, you know what, this is common in Black people. And so I think that, it's just you, basically. And this was a white doctor. So then that was fine. Fast forward to 2020, I want to say maybe 4 or so. I did my blood work again, and then got another call from a doctor saying, oh my gosh, it's even lower than it was 2-3 years ago. This is a problem. And then again, listing all of the things that it could be, all these grave, analysis of what it could be, or prognosis. And again, you need to follow a hematologist. So there I go again, back to a hematologist, and he does a whole battery of tests. And again, testing for all of the things, and in tuberculosis, I can't even pronounce it. Like, you name it, things I can't even pronounce, they were testing. And then that doctor told me that he also wanted to do a spinal tap. And that's when I said, heck no. I am so done with this. We have done so many tests. Everything has come back negative. I'm not going to allow you to go in my back. It's not happening. So I declined that test. And fast forward, and I'm still here. And the good news is, I found a black doctor, like this doctor in the video was saying. It's important to have a black doctor, and that black woman got a black doctor who was able to look at her blood labs and say, this is what it is. And this is, this is our thing. This is something that, is common with black people. And that's what I was told by my Nigerian doctor. So herein lies the importance of, like I said, race-based data. That's the first thing. And having a black doctor who understands your DNA and is able to look at our blood labs and look at our tests and do further and more thorough work, and order more thorough testing if need be, because there's a clear understanding of our DNA, of our makeup. And I'm so grateful. Shout out to Phoenix Medical Clinic. Shout out to Dr. Daniel Lude and Dr. Ugama, Gabriel Ugama, and the other doctors there that are all Nigerian, and they get it. They're great. It's a great clinic. Anybody that lives in the Niagara region, to my brothers and sisters, head over to Phoenix Medical Clinic, downtown St. Catharines on Queen Street. Google it. They are amazing, and they get it. And that's the important thing. And that's the important message here. And one other thing that we need as black people is our own clinics, our own hospitals, where it's our own doctors, nurses, and medical staff. That is crucial to our health. Because if you look at it, look at all of the misdiagnoses that happen. This is just one of many. Look at how many people have been diagnosed with cancer and this and that. Look at the amount of people that are misdiagnosed based on the calculations that they have to do with our labs based on a 30 to 40-year-old white male. Look at all of the misconceptions about, oh, black people have thick skin so they can take pain, so that when we're in pain, it's not taken seriously. Look at how many doctors aren't able to prescribe the right medicines for us to treat things that we have going on. Look at how much racial profiling goes on with black people, within the healthcare system, and not taking us seriously and thinking we're just there for drugs, and automatically the prejudices that come when we are saying we're suffering. Look at the anti-black systemic racism that goes on in these healthcare institutions, with black nurses, black doctors being called names, being told, I don't want you treated by me, being told, I don't want to be touched by no N-word, and all of the things. I can go on and on. But I think, I'm pretty much made my point of why it's super important that we take charge of our health. We make sure as well that we educate ourselves on our bodies and our makeup and stuff. I know for me personally, I love to do study and really understand how to read my blood work. And I'll literally sit there with a cup of tea and I'll be reading my blood work, reading my results. I ask a lot of questions. I ask my doctor a lot of questions. I ask nurses a lot of questions. So I really try to understand what's going on in my body. And so that if I am not satisfied with the response I'm getting from a doctor, whether it's my doctor, which I'm very happy with, but sometimes if you ever go to a specialist, the specialist is not black, right? And if I'm not happy with the result, I'm going back to where I know. I'm going back to black, okay? And I'm going back there for second, third, fourth opinions. We have to take charge of our health. We do. So further from just doing the best in what we put in our body, we also have to make sure we do our diligence as it relates to the healthcare industry, because we face way too much. Okay. So that's my 2 cents. And I'm grateful that this black woman found a good black doctor. And that's what I really urge all of us to labor to do. Okay. And let me know what you think about all of this. Drop your comments in the chat. Don't forget to like, subscribe, share. Don't forget to download the African Diaspora News app from your Google or Apple store. And don't forget to subscribe to my YouTube channel, Emma Ansah Unfiltered. Until next time, please be safe, everyone.